Hello friends, my name is Dr. Amit. I am the consultant orthopedic surgeon at Sundaram Medical Foundation. Let's talk about minimally invasive surgery. Now, a lot of patients who come to my OPD or I see them in the emergency, they have this question about can you do this in a keyhole fashion? So this keyhole trend has started a few years ago with minimally, what we call in our medical jargon as minimally invasive surgery or minimal access surgery. What it means is we try to leave a very small footprint on the outside and we can do a much larger work on the inside of the body, but from the outside it's not visible. So unlike other specialties, like you do something like a laparoscopy, where you have some abdominal condition and there's a hernia repair or a gallbladder surgery, which you can do because they are soft tissues. So it's easy to get in through a small portal and whatever needs to be removed can be removed through a small portal. Bones are very different. So you're working on the chassis of the body and these are large structures, very hard structures, and operating on them is very difficult through small incisions. We have minimal access surgery for many years, for decades together, for things like the spine or the arthroscopic surgery, like in a knee, if you have a meniscus tear or a cruciate ligament tear, we do all the surgeries with minimal access or keyhole surgery. However, when it comes to fractures, for a very long time, the only options were if you had to put a plate or if you had to put a nail, you had to put a really large incision exposing the entire length of the bone, and only then you could work on the bone because you had to see it. It's a hard tissue, structural tissue. However, over the past few decades, advancements in medical science have allowed us to now offer minimal access surgery or minimally invasive surgery even in fractures. At SMF, we've been doing it for over a decade now. And some of the recent implants, some of the first implants that allowed minimal access surgery, we were the first people in the city to start using it. So with plating, if you have even a thigh bone fracture and there's is the largest bone in the body, but even that can be done with 6 to 8 centimeter incisions, very small fine stabs in the incisions. We can do nails, we can do plates. There are a lot of options now which give you minimal access advantages. However, the second question that the patient asks about cosmesis, about scars is, what I try to explain to them is, we don't put small incisions for cosmetic reasons. The reason is that you're damaging as less soft tissue as possible, and with the small window, you are able to do a work of a much, or what would require a much larger window previously. But the footprint on the soft tissue is so less that the patient can start getting out of bed the next day itself. Within a few days, they can start walking, they can start bending joints and moving around, something which used to take weeks or months earlier. So the post-operative recovery is faster, the damage to the bone blood supply is lesser because you are not stripping off a lot of soft tissue, which eventually provides nutrition to the bone. It's a living tissue after all. So minimal access surgery in orthopedics is aimed not toward cosmesis, which is a byproduct of it, but for early return to function, less bleeding, less post-operative pain, and faster healing and return to function. So this is what minimally invasive surgery is when it comes to orthopedics. Thank you.